you're welcome back to my channel. Today I wanted to record outside, but it's very windy, so I might go inside to finish the video. So this video was requested by Theodore Wuni. He wanted me to share my experience, lessons I've learned living in the UK for 20 years, the good, the bad, and lessons learned. So in today's video, that's exactly what I'm going to be discussing. So if you like to know more about it, why not watch the video to the end? So you're welcome back to the main video. If this is the first time you've come across my channel, you're very welcome. Please remember to like, subscribe, and share. So I'm going to go straight and start talking about the main video. So the first thing is about my arrival. So I trained in Ghana. I went to University of Ghana. I completed my degree in 1999, and we used to go and do 1 year placements all over before doing the Nursing and Midwifery Council examination. So I had my nursing registration in 2000. So I have been a nurse for 23 good years. Out of that 23, I've spent just about 3 years, or just under 3 years in Ghana, or about 3 years in Ghana, working in Abita Hospital in Tema. And then I have been nursing in the UK since 2003. And I have worked in the NHS for 20 years exactly this month, because on arrival I was working, or I was doing my adaptation program in a care home for a short period. I didn't like that aspect of nursing, so I changed, and then I came to the NHS July 2003, I'm sorry. So that is my life. And so arriving in a new country, completely new weather, meeting different people. It was cold when I arrived, and I struggled with the cold. I was almost freezing. If you have seen all my videos, I've talked about this experience. Now, yes, I still feel cold, but I'm a little bit used to the cold now. So let's go to the good. So I would say first impressions. I arrived in London Heathrow Airport, so I would say, you know what, it was clean, it was lovely, and the laws in the UK do work most of the time. Definitely the laws do work. There is orderliness, I would say, as well, evidencing when you're going to join a bus, you see people in a queue, and you have to also join the queue and just stand until the bus comes. You don't jump the queue. So there are public toilets, there are social amenities, and also like there are neighborhood parks in certain areas where your kids could go and play. As I said about other amenities and social amenities, public toilets, I remember when some of us were growing up in Ghana in the early 70s, it's more or less like if you don't have a toilet in your house, you have to go to the bush and do the thing. But over here, at least, there are several public toilets. When you go shopping even, you will see the signs showing. So if you're struggling, you'll be able to use a public toilet if you want. There are credit facilities in the UK, but you have to be very careful, otherwise you get yourself in debt. You should be able to afford what you are going for. Don't just rush and say you're going to get this credit to buy a car, to buy this and do that, if you do not have, you know that you will not be able to pay back. So the credit facilities are there. Let's talk about schools. So in the UK, as compared to Ghana, where parents have to pay fees, in the UK, I don't know if things have changed in Ghana, but as far as I'm aware, I'm talking about UK now because I know more about UK now as compared to Ghana. When I was there, things were different. My parents were paying for school fees. So in the UK, for school-age children, it's free education from primary school up to sixth form. And then when you get to university, you are offered tuition fee loan and maintenance loan. So by the time you finish uni, you're in debt actually, but you don't start paying that loan back unless of course you start earning a particular amount of money. I think it's about £25,000 per annum. I can't be wrong, but I know it's around that amount of money. When you start earning a particular amount of money, then you start paying your loan with little interest. So that is how their educational system is. Another thing I remember is back home, if your parents haven't got the money, then you're going to be struggling. As well as if you're going to university, I would say from my own personal experience, it is based on merit as opposed to who you know or how much you go and pay. Especially in certain specialties or courses, if you want your child to go and do medicine, when I was back home, you should have a family who is a doctor, or you should have money to go and pay somebody. I don't know if that still happens, but I'm just trying to do a little comparison and just say how things are here, the good about the UK. Or so, like, for example, when my daughter was due to go to uni, yes, she went through the process. Fortunately, she got the entry, or she got the grades, and she passed her interview and things in order to go into medical school. So I can say from that experience that she went through public school and all that, and in the end, yes, she was able to get entry. I'm not a doctor. Her dad is not a doctor. I don't have a doctor in the family, and I didn't have to go and pay anyone, and she was still able to get into it. So let's talk about work. So at work, another thing I have to say in the UK, which is a good thing, is the fact that you have got the equipment to work with. When you arrive the first time, you find out, oh my God, some of these things are so complex. Am I going to be able to? You would be taught how to do these things. There are opportunities to develop if you want to. I'm talking again from my own experience. I started from our time. It was called B grade, which is now like a healthcare assistant, or let's say nurse associate level. And I've worked through from band B grade. Now the grade I'm on is G grade those days. So that those days they have B, D, E, F, and G. So G's now I would say are band 7s. Now we have band 5, which is the starting point. You go to band 6 and you go to band 7. Maybe I should start looking for a band 8 role. I'm capable, so you never know. In the future, I might just tell myself, you know what, I'm happy where I am and I just want to carry on and do my job. So the opportunities are there if you challenge yourself. Sometimes you will get a lot of knockbacks, and do not let that stop you from pursuing what you want to, career progression. Unless of course you've come here, you want to just make money and go back. That is different. You can work, do agency, save money and go back if that is what you want. There are protocols to work with. There are competencies you have to work as a nurse as well. Apart from those of us who are nurses, you know, people who are non-nurses, you can do, there are a lot of jobs like factory jobs. If you can't find what training you have or what you have trained in to do, you can work in the factories. People do cleaning in hospitals, people do different types of jobs, or you become your own boss and work in your own house. So with regards to work, I would say the opportunities are there for you. If you're hardworking, yes, you'll be able to work. Back to nursing, professional development is available. Sometimes you have to show you are interested. If you sit down, one thing is nobody would push you. I've done a video on professional development in the UK as a nurse. Nobody would push you. No one would promote you automatically. So you have to look for the opportunities yourself and go for it. There are competencies before you do anything extra as a nurse. You have to be taught how to do it. You have to be signed off as competent. I remember when we finished nursing school, graduated, and we're working back home, you just learn on the job. You just go and you know what, you start cannulating. I can cannulate a child, I can cannulate an adult because I was working both ways. But here, you're either a pediatric nurse, you are either an adult nurse, you are either, you know, Ghana, even sometimes people are dual trained, and it's the same here anyway. So you can do a bit of deliveries as well because it was part of our training. So a lot of competencies. There are a lot of professional development or specialization in the UK. I have worked as a sickle cell specialist nurse. After working all on the wards and outpatient, surgical, renal and all that, I did a specialist nurse. I became sickle cell nurse. I became an epilepsy nurse. And now I'm a headache nurse. And I give treatment to patients. And job satisfaction, yes, I would say I do have job satisfaction in what I do currently as well, as evidenced in some of the feedback I get from my patient. So yes, there are those opportunities. If you look for them, you would get it. So that's about that. Now let's talk about salaries. The salaries in the UK definitely better than where I came from. I would say again, Ghana. And currently I think is the same. The only difference I would say, I don't know about expenditure back home because cost of living is so high now. So you will collect your salary. Yes, it's a good money. But now, as you know, because of the high cost of living, you take the salary and you also become a paymaster. You pay your rent or your mortgage. You pay your council tax, you pay your gas, electricity, and all other expenses or expenditure. Before you know it, unfortunately, you haven't got a lot left for you to say, I want to save this good amount of money. So these are some of the things. Yes, the salary is good. If you're a single person, yes, you can work and work extra. You can manage to save money if you are doing a little bit extra shift or you're going out and doing agency and all that. Yes, you can save. But on the basic salary that we get as nurses, I don't think it's that much, but still comparatively to back home where some of us came from, I would say the salary in the UK is still better, although as nurses we are still asking for more. We did ask for more, we got some, but oh well, I don't know what the future holds. So let's start talking about the bad. I'm squinting a bit because I've written I don't want to wear my glasses this time. So bear with me. I might have to wear my glasses at some point. So the first I would say is about the fact that you feel a bit lonely. It is very, very isolating when you come here. Another thing I would say about the bad is you or your children may encounter some form of discrimination, microaggression, or racism. Yes, you are in somebody's country. Not everybody like foreigners coming here. So yes, there are situations where you may feel that way, or you will experience things like that, be it at the workplace, be it at the shopping center, be it just outside on a bus or something like that. There are people, I would say, they don't want to live close to, or they don't want neighbors who are like me or like you. So there are little things like that you would experience. It's not a lot, but it does exist. I'm talking from experience because my own daughter did experience racism at school from her own peers. So do not question me. What I'm saying is more rough based on my own personal experience or family's experience, as well as what I have observed from outside. So that's about that. So it can be isolating. You would lose a bit of link with close families. And although yes, these days you can call, you can video chat and all those things. And back home, as you know, we attend funerals, we attend weddings. Sometimes you're not even invited, but you just get crash it and nobody will say anything. But here it is only by invitation, and we don't have these things so many, unless you're living in London or other places where they have a lot of our people and they organize things. But you know, sometimes you feel isolated. Your children are stuck in the house, they are not going out, just as we are home. They can go and play with other children, not that common here. So they are stuck indoors. What do? They're on their games, they are playing, you know. So things like that are some of the things I feel are the bad. I'm carrying on with the bad. Also, because of social isolation or feeling isolated and feeling lonely, you can actually find a church, or you can also find some of society's organizations that may be from your country or you are used to, and you can join them and that would help you. So sickness. So in the UK, when you arrive, you have to register with a general practitioner, which is in primary care. That is how healthcare is provided. That is for non-emergency cases. If it is emergency, you will call 999. That is emergency, life-threatening emergency. For other things, what you would have to do would be, so first of all, register with a general practice, or a GP, we call it in short GP. When you register and when you feel sick and it is, or you feel ill and it is non-emergency, what you have to do is to call the reception at your general practice or the practice you have been registered with in your locality. There is a phone number to that practice, and most of the practices, I would say from where I am registered, you have to ring by 8 o'clock in the morning. And when you ring, I would say healthcare like that is very frustrating in the UK as compared to back home, where you can just walk into any hospital. If you have money and you want to go to private hospital, you just walk into a private hospital and be looked after, whichever. But over here, it is strictly by registration, unless of course you are not registered, you are visiting, you are sick, then you have to go to either urgent care center or A&E. But apart from that, if you're living and working in the UK, you have to go through your GP regardless. If your GPs are closed, then you're advised to ring 111. You can always ring 1114 for minor health advice anyway. Now, when you ring at 8 o'clock, I'll tell you my experience. You're on the phone, 8 a.m., you call, and then you realize, oh my God, no, the line is busy. You can be ringing over 20 to 30 times, the line is busy. And when you finally get through, you would hear, oh, you are number 20 on the waiting list or whatever, waiting on the list or on the call. So you have to hold on. If you really need to, you need to speak to a doctor, you would have to hold on until all those number 30 would come down to your turn before you'll be able to speak to the receptionist, not the doctor. And after speaking to the receptionist, then she would ask you questions about what your symptoms are and all that. Then she'll be able to say who would see you. And now, because of COVID, they're not doing a lot of face-to-face. They're doing most of the consultations over the phone or telecommunication or teleconsultations. And so they will speak to you over the phone. If they feel they need to examine you, they'll make an appointment for you to come in to be examined. But some of the things they advise over the phone. So that is very frustrating. Once again, if it is emergency, if it is life and death, it is A&E. You have to go to our emergency department. If you need to ring because you can't drive yourself or someone can't drive you there, then it would be 999 for the ambulance anyway. Sometimes, unfortunately, these days, even with the ambulances, there are delays. So it's not as great. Although when you get to the system, the care, I would say, is good. The common illness in the UK, back home we have catarrh and but over here it's called, we do have influenza infection, is it? Yeah, so it's flu and cold, and it can be horrible. We don't have malaria, but flu and cold, it's serious. But oh well, most often you can manage these things at home. So those are about the sickness. So the next thing I've got on the list to talk about is childcare. Childcare is another difficulties that we face as foreigners in the UK, because back home you have family members who may support you, or you can pay someone to live with you, and they care for your children when you go to work, or but unfortunately over here we have nobody to look after our children for us. So you spend a lot of money. You can make money, but some of it can go into childcare. And in some families, both husband and wife normally have to share the responsibility. Someone can be doing night, someone can be doing day. So there's always someone at home to look after the children. The men, unfortunately, are having to learn how to change nappies, how to look after babies and things like that. So unless, of course, you both have the money and you can afford any childcare, why not? It's available here, but it is extremely expensive. The next thing I'm going to be talking about is about stress. There is a lot of stress in this country, especially at work, even outside of work, because there's too much pressure. There's a lot of workload. There is a lot of responsibility. Sometimes there can be pressure from management or at the top or from your managers, yes, at work. So even from your peers as well. So pressure, some people do experience bullying, harassment and things like that at work. A few people, it's not everywhere, but people do experience. I haven't experienced anything like that before, so I can't say. So in the end, some people end up, due to some of these things, some people end up having stress, people having anxiety, people having depression. It is very common in this country. So I will plead with you when you get here, please be careful, look after yourself, look after your mental health, because it is something which is common over here. Another thing I've got to say is about marriages. As you know, marriages can break down everywhere or anywhere, but I would say in the UK, and for that matter, other overseas countries where we have all migrated and we are living in a different country, sometimes things become very difficult, stress here and there, and these things can actually lead to a lot of marriage breakdowns, and it is very common in this country. And some of the different reasons why these things do happen, I've made a list. One of them, role reversal. So let's say the woman was the main earner back home, or the man was the main earner, the head of the family, we call them back home, and then we get here and maybe you realize that maybe the lady now is earning more, and the men sometimes don't like that. They want to be in charge, and some people can find that very difficult. As well, some of the men were in a very good and well-paying job, but made the decision to come to the UK in order to keep the family together. And then when these things start happening, it becomes a big problem. And then, fight and anger and all those things, and marriages can break as a result of that. So be careful when you get here. Another one is about work schedules. So maybe one is working at night, one is working during the day because of childcare. In the end, you realize that you lack that intimacy, and and then things just become stale, and things can fizzle out. Another one is about cheating. So sometimes the men, or it could be the other way around, I don't know. They go home and they have somebody else back home before the woman knows from here. Maybe he's got another child back home. The woman here doesn't know for a long time before. And then maybe someone gossips one day to them that, oh, do you know that your husband has got children? Anyway, so some of these things can be a problem. Another one is lack of respect. Yes, I know someone from back home would be saying, what? Yes, relationships, you have to respect each other. You respect me, I respect you back. But sometimes you realize some people have certain habits. I'm the head of the family, so what I say is what I say. No, it should be what we both say, listening to each other. So sometimes these things do happen, and can lack of respect. It could be from woman to man or man to woman, and those things don't help relationships. Sometimes relationships do break down because of abuse in the relationship. You get here, be careful. If you are an abuser of a woman and you come to the UK, be very careful, because the next moment police would be at your door and you would find yourself in trouble. So please beware. Another one is another thing that can lead to marriage breakdown would be control. So some men would say, or the other way around, it could be the woman saying, you know what, I have helped you and I brought you here. Now you have changed. Or the same way from the man. I've helped you, I brought you here, I made you who you are today. So it's either way, either the woman saying to the man, I made you who you are today, I looked after you, I paid your tickets, I brought you here. Or the man would say, I looked after you in university, I chose your course for you, I paid for everything, I brought you here, now you have changed. Some people listen to what people say from back home. So just be careful. I'm just saying it. These are some of the things that do happen. And these are some of the things that can lead to marriage breakdowns. And the rate of marriage breakdowns overseas is very high because we are not like back home where maybe family members will call you and say, oh, don't do that, don't do that. No. Someone would tell you the system here, especially in the UK, someone would say favors women more than the men. I think it favors everybody, but it's just that when you get here, yeah, I would say somehow. Anyway, I'm not going too much into that. And some of the reasons some people actually have marriage breakdown could be the fact that there is envy. Maybe this one would say, oh, you were nobody. Now because you're this, you are not respecting or do it. So things like that can happen as well. Let's carry on. So I've got a long list of things I'm talking about today. Another thing which is a bad one is we lose out of those close relationships. So unless, of course, you're not a family-oriented person, but most of us from Ghana, I would say we are very family-oriented. You're family-loving people, and like you're here on your own, it's like you and your child. And it's not that interesting. And you realize your children do lose out of their cousins, they don't know them, and they are here. When they get home, they don't know who is who. They don't know their uncles. They don't know their aunties very well. They've seen them on video calls and things like that, but that is not enough. Unless, of course, you've been going home frequently, that is different. Even that. And apart from that, our children do lose out that family culture of our country. Some of them don't speak the language. Because it's difficult. Some of the kids do have language difficulties when they're growing up, and you don't want to confuse them with your language as well. So you end up with the English because you want to help them, and then you realize, they lose out in the language. They don't know the culture. I remember when we were growing back home, at the age of 13, 14, 15, you were doing a lot of chores in the house. You're cooking for the family and things like that. But some of our children in this country, they are 15, 16, 17. Unfortunately, even the girls especially, they can't cook. All they want is they want chicken and chips, they want McDonald's, they want this and that. So these are some of the things. And most of our children become fussy eaters in this country. You would cook your fufu, you would cook your banku, you would cook your yam and whatever. When they're young, some of them are interested, but when they start growing, you cook this and that. Oh, mom, I don't like this. Oh, this is smelling, I don't want it. The only thing some of them like is like the jollof rice or maybe the plantain. So you end up cooking different things, or some would want to go and buy McDonald's because they don't like your fufu or your banku or whatever. So those are some of the things. So when you're bringing your new children here, don't let them taste McDonald's and some of those things. Otherwise, before you know it, they tell you, I don't want fufu, I don't want banku. Anyway, so that is, by the way, it's part of some of the things. And talking back about one of the bad, which is about isolation and all that. There are people where you go and rent. I've said that already. You may be living in a community where your next door neighbor doesn't know your name, or you don't even know them. You haven't seen them before. There was an issue where a lady, unfortunately or sadly, died for a couple of years. and no one knew she was dead in her house. There are people living in this country and they have no families. They come to hospital. Who is your next of kin? I don't have any. So, we still need to keep families and friends. Over here, some of us, our friends have become our families in the UK. So you can do the same. Go to church and all that. So lessons I have learned. So I've talked about the good. I've talked about the bad. I'm now going to be talking about some of the lessons I have learned. So if I have to do this again, the question is, would I come and, stay for that long? Maybe I might do it differently. I might come, work, make some money, go back and establish something back home, because Ghana is interesting. I loved Ghana. I was enjoying my life in Ghana before coming. You might be asking, why did I come? I never thought in my life I would be relocating to the... In life, as you know, there are ups and downs in every decision you make. So there are positives, there are negatives. It is how you manage it. And things might not be how you envisage things to be. Not everybody living in the UK is or working and living from abroad, or you've come from wherever to UK. Not everyone is rich. Not everybody makes it in a brochure, we call it, or Meya Brochi. Not everyone makes it in a brochi or overseas. Some people make it, some people don't. It is how you work things out yourself. Now, when you arrive, you have to make a plan as to what you want to achieve, and then you go by your plan. And I believe you can make it however you want it to be, depending on your plan. Finally, as I said, if our salaries actually were to be good back home, I think maybe I would rather stay back home, but I might be wrong. But it's very good to travel and see. You need to travel and see what is on the other side. If you are rich and you're working, you've got everything back home, there is no point saying, I want to go and work in the UK as a nurse. You can always visit and go back. Life is a journey. It is full of surprises. There is good, there is bad. You as an individual, you are the driver of that journey, and please make it safe to where you want to take yourself to. Thank you for watching. Thank you for listening. I hope this video has been helpful. Take care of yourselves, and I'll see you again soon. Bye-bye.